Welcome to the weekly Neurology Deep Dive, where we help busy neurologists like you stay up to date with the latest research.
You got it.
This week, we're diving into the Zilucoplan data from the Healy ALS platform trial.
A very interesting study, for sure.
And remember, this is for educational purposes only and just a summary, so you'll want to check out the full paper for all the details.
Absolutely.
So the Healy ALS platform trial is designed to test multiple treatments for ALS at the same time, which is a pretty huge deal.
It is. It's a game changer because it uses a shared placebo group across all these different treatments, making research much more efficient.
So that means they can test more things in less time.
Exactly. It's like a parallel track system for ALS research.
For this deep dive, we're focusing on the Zilucoplan regimen, or regimen A.
Right.
This drug inhibits component 5, or C5, which is a protein involved in inflammation.
And that's a key target because inflammation is thought to play a role in how ALS progresses.
So the thinking is that by targeting C5, Zilucoplan could potentially reduce inflammation in the central nervous system, which might slow down the disease.
That's the hope.
All right, so let's get to the results. Did Zilucoplan actually work?
Well, the primary outcome of the trial was a combined measure of function and survival.
Okay.
And unfortunately, it did not show a statistically significant difference between Zilucoplan and placebo in slowing ALS progression.
So that's obviously disappointing.
It is. It would have been great to see a positive result.
What was the disease rate ratio, or DRR?
The DRR was 1.07 with a 95% credible interval of 0.87 to 1.31.
And just to remind our listeners, what does that mean?
A DRR less than 1 would have indicated that Zilucoplan was slowing disease progression.
Got it. So even though both the Zilucoplan group and the placebo group experienced decline, the difference wasn't large enough to be statistically significant.
Exactly.
What about the secondary outcomes? Things like changes in lung function, muscle strength, or time to loss of muscle strength?
None of the secondary outcomes showed a statistically significant difference either.
Okay, and what about safety?
The safety profile of Zilucoplan was comparable to placebo.
That's good to hear, at least.
The most common adverse events were things we typically see in ALS patients anyway. Things like shortness of breath, difficulty speaking, muscle weakness, and falls.
Okay, so let's dive a little deeper into the specifics of the trial. Who were these participants?
The study included 122 participants on Zilucoplan and 40 on placebo.
And what was the average age?
The average age was 58.2 years for the Zilucoplan group and 59.1 for the placebo group.
So pretty similar.
Very similar. And the majority of participants were male, 74.6% in the Zilucoplan group and 75% in the placebo group.
Okay. What were the key inclusion criteria for the trial?
Participants had to have a definite diagnosis of ALS according to the ELSCORIAL criteria. Their symptom onset had to be within 36 months of screening, and they needed to have been on a stable dose of either riluzole or edaravone for at least 30 days before screening.
And were there any specific requirements about the riluzole or edaravone dosing?
Yeah, participants had to agree to continue their current dose of whichever one they were on throughout the study.
Got it. And what about exclusion criteria? What would exclude someone from participating?
Well, a few things would exclude someone from the trial. Unstable medical conditions like heart problems, infections, or thyroid issues were not allowed. Neither were significant lab abnormalities or ECG changes like abnormal liver or kidney function, unstable psychiatric conditions, cognitive impairment, dementia, or substance abuse that could interfere with informed consent were also excluded.
Okay, so pretty standard exclusions for a clinical trial. What about cancer?
Active cancer was an exclusion criterion, although there were some exceptions to that. The investigators also had the right to exclude anyone if they felt a participant was at increased risk or couldn't fully participate in the study.
So they were looking for a relatively healthy ALS population to get the cleanest data possible.
Exactly. They wanted to minimize the chance of other factors influencing the results.
Okay, let's talk about the details of the Zilucoplan treatment itself. How was it given and at what dose?
Zilucoplan was given subcutaneously, meaning it was injected under the skin at a dose of 0.3 milligrams per kilogram of body weight every day for 24 weeks.
All right, and how did they assess if the drug was actually working on the complement system?
They used a test called the Wieslab assay to measure complement activity in blood samples taken at different time points throughout the study.
And what did those results show?
They confirmed that Zilucoplan was effectively inhibiting the alternative complement pathway. So it was doing what it was supposed to do on a molecular level.
So even though the trial didn't show a clinical benefit,
Yeah.
it did confirm that the drug was working as expected.
Right, it was hitting its target, but unfortunately that didn't translate into a clear improvement for the patients.
Okay.
And that highlights the complexity of ALS as a disease and the challenges we face in finding effective treatments.
It definitely does.
Yeah.
Now let's unpack the data itself a bit further. This is where it gets really interesting for neurologists like you. The paper provided a lot of detail about baseline characteristics and the specific outcomes measured.
One thing that jumped out at me was the average disease duration from symptom onset to screening. It was 17.4 months for the Zilucoplan group and 18.1 months for the placebo group.
So essentially the same.
Almost identical.
So both groups were at a similar stage in their disease progression when they started the trial.
Right.
What about their functional impairment at the start of the trial?
The average baseline ALS-FRSR score was 34.4 for the Zilucoplan group and 35.1 for placebo.
And for those who don't use the ALS-FRSR every day,
Right.
remind us what that scale means.
So the ALS-FRSR scale goes from 0 to 48, with lower scores indicating greater disability.
Okay.
So these scores suggest that both groups started with moderate levels of functional impairment.
All right. Now getting into the results of the primary outcome, the paper mentions a Bayesian shared parameter model.
Yeah.
Can you explain why they use this type of analysis?
This type of model is particularly useful when you're analyzing combined outcomes like function and survival,
Okay.
because it takes into account that these two things are related.
That makes sense. So someone with worsening function might also be at a higher risk of death.
Exactly.
So the model helps to kind of disentangle those effects.
Precisely.
And while the results weren't what we'd hoped for,
Right.
the trial did generate some valuable data. For instance, they found that the average rate of decline on the ALSFR-R was 1.11 points per month for the Zilucoplan group, compared to 1.03 points per month for the placebo group.
A very slight difference.
Again, a difference, but not statistically significant.
Right.
What about the other secondary outcomes? Were there any trends worth noting?
There weren't any statistically significant findings for the secondary outcomes either.
Okay.
But the detailed breakdown of these measures in the paper offers some interesting insights for future research.
Okay.
For example, they looked at changes in slow vital capacity.
Which is a measure of lung function.
Exactly. And what do they find? They found that the average decline in slow vital capacity from baseline to week 24 was very similar between the Zilucoplan and placebo groups.
They also looked at muscle strength using handheld dynamometry. What did those results show?
Again, no statistically significant differences were observed.
Okay.
But the paper provides detailed data on the changes in strength for each muscle group tested.
Wow.
This level of granularity can be helpful for researchers who are designing future studies.
That's really interesting. So even though the overall results were negative,
Yeah.
it sounds like there's still a lot of useful information in there.
Absolutely. Even a negative trial can provide valuable data for moving the field forward.
It's almost like every trial is a step forward in some way.
That's a great way to put it. Each trial helps us refine our understanding of the disease and guide future research.
We've talked about the trial design, the participants, and the results, which unfortunately weren't what we were hoping for. But I think it's important to dig into the data itself a little bit more and see what we can learn from it.
I agree.
What were some of the specific numbers that stood out to you?
Well, one thing that I noticed was the average time from symptom onset to screening was almost identical between the two groups.
Oh, interesting.
It was 17.4 months for the Zilucoplan group and 18.1 for the placebo.
So both groups were at a pretty similar stage in their disease progression when they enrolled in the trial.
Yeah, pretty much.
What about their functional impairment at the start of the trial?
The average baseline ALA-SFRSR score was 34.4 for those on Zilucoplan and 35.1 for the placebo group.
Okay, so that suggests both groups started with moderate levels of functional impairment.
Right.
It's helpful to keep those numbers in mind when we're thinking about the results.
Absolutely.
The paper also provides a very detailed breakdown of the secondary outcomes.
It does.
For example, they looked at the rate of decline in slow vital capacity, which is a measure of lung function.
Right.
Did they find any differences between the groups there?
The average decline was actually pretty similar between the two groups.
Ah.
It highlights the fact that even though Zilucoplan was targeting inflammation, it didn't seem to have a protective effect on lung function in these patients.
That's interesting.
They also measured muscle strength using handheld dynamometry, and the paper actually breaks down the changes in strength for each muscle group tested.
Wow, that's a lot of detail.
Yeah, it is. And while there weren't any statistically significant differences overall, I think this granular data could be really valuable for future research.
It's amazing how even a trial with negative results can provide so much useful information.
I completely agree. Every trial, whether it's positive or negative, contributes to our understanding of ALS and brings us closer to finding effective treatments.
So to bring this all back to our listeners, what are the key takeaways from this trial for neurologists who are treating ALS patients in their practice?
Well, based on this trial, I don't think we can recommend Zilucoplan as a treatment option for ALS.
Makes sense.
The data just doesn't support its use at this time.
What should neurologists tell their patients who might be asking about Zilucoplan or who are interested in trying it?
I think it's important to have an open and honest conversation with patients about the trial's findings.
Yeah.
Explain that while Zilucoplan showed some promise in earlier studies, it ultimately didn't demonstrate a clinical benefit in this larger phase 3 trial.
Right.
But I think it's also important to emphasize that research is ongoing and there are other potential treatments in the pipeline.
That's a good point. Hope is so important for these patients.
It really is. And this trial also highlights how important it is to participate in clinical trials whenever possible.
Yeah.
Because it's really through these trials that we're going to find effective treatments for ALS.
Well, thank you so much for joining us today and walking us through this really important trial.
Was my pleasure.
It was a fascinating discussion. And to our listeners, we hope this information was helpful for your clinical practice. And as always, please remember to consult the full publication for a complete understanding of the study and its findings. And until next time, keep exploring the latest advancements in neurology. We'll be here to help guide you through the most impactful research.
Sounds good.